All right, let's dive right in. Today, we are breaking down a guide that is designed to completely rewire how you think about the Nclex. You know that feeling where you're just drowning in facts but can't quite see the big picture? Well, if that's you, you're in exactly the right place. Let's get started. So let's just tackle the big, scary question right out of the gate, the one that keeps so many nursing students up at night. You've aced your classes, you absolutely know the material, so why is this exam such a massive hurdle? Well, the answer might surprise you. And get this, it has almost nothing to do with how smart you are. And here it is. This quote just nails the whole problem. Way too many students treat the Nclex like it's some giant national trivia contest, when it's actually a thinking test. See, the key isn't to cram more facts into your brain, it's to learn the logic of the exam itself. It's about learning how it thinks. Which brings us right to our first section, getting into the right mindset. And I'm not talking about memorizing more pharmacology here. This is about understanding that the entire exam, every single question, is built around one single powerful idea: patient safety. Okay, this is a fantastic concept from the guide. It's called the Utopia Hospital Rule. In the world of the Nclex, you're not in that chaotic, understaffed clinic you might have done your clinicals in. Nope, you have everything you need. You've got full staffing, all the equipment works, and help is always available. This is so important because it removes all the real-world excuses. Your only job is to choose the safest possible action every single time. Seriously, let this be your mantra. Write it down. The exam is not trying to find the most brilliant genius diagnostician. It's not looking for the nurse who knows the most about pathophysiology. It's looking for the nurse who is consistently, reliably, and, predictably safe. Now this comparison is so incredibly useful. We're often trained to look for that impressive hero answer, right? The one that sounds super smart. But the Nclex rewards the total opposite. It wants this simple, conservative, even boring choice. And why is that? Because in nursing, boring is safe, and dramatic is risky. And here we go. This is the first huge trap the guide points out. Your gut instinct might be to jump in and fix the problem immediately, but the Nclex wants you to assess before you act. Unless the patient is actively dying right in front of you, we're talking airway obstruction, major hemorrhage, your first step is almost always to gather more information. You just can't fix what you haven't assessed. So building on that whole safety mindset, Section 2 is all about prioritization. This is where so many of the make-or-break questions live. It's not just about what you should do, but who you need to see first, and for that, you need a rock-solid framework. Okay, the single most important rule to learn is how to tell the difference between a stable and an unstable patient. An unstable patient is someone whose condition is actively changing right now. They have new symptoms, their vitals are getting worse. They are always your priority. A stable patient, even if they have a really serious chronic diagnosis, can wait. And this just drills down on that rule even more. You have to pay super close attention to the phrase new onset. On the Nclex, that is a massive clue. A new problem means there's an unknown and immediate risk. New chest pain could be a heart attack, right? But chronic angina is an expected finding for that patient. The new problem always wins. This right here, this is where so many people get tripped up. It's really easy to look at the board and assume the patient with stage 4 cancer is the #1 priority. But if they're stable and the patient next door with a simple fracture suddenly develops new confusion, guess what? The fracture patient is your priority. It is all about instability, not how scary the diagnosis sounds. Now, Maslow's hierarchy, it's a great tool, but it's so often misused on the Nclex. The guide is crystal clear about this. It is a tiebreaker, not your primary weapon. What does that mean? It means you only use it after all the immediate, life-threatening stuff has been dealt with. You always handle airway, breathing, circulation, and physical safety first. The rest of that pyramid can only be considered after those are totally secure. Okay, moving into Section 3, and this is where the stakes get even higher. We are now in what the guide calls the zero tolerance zones. These are topics where the Nclex has almost no room for error, because a mistake in these areas can lead to catastrophic harm for a patient. You've got to get this. A mistake with infection control or failing to spot a bleed isn't just a minor error where you lose a point. The exam's computer treats these as critical safety failures. Why? Well, an infection control mistake can harm multiple patients, and a missed bleed can be fatal in just a few minutes. You just have to know these precautions cold. There's no guesswork here. This is pure must-know information. For contact, like C. diff, you need a gown and gloves. For droplet, like the flu, you need a surgical mask. And for airborne, like TB or measles, it has to be an N95 respirator. That's it.
And it's not just what PPE to wear, it's the order you put it on. The order for donning or putting it on is absolutely critical for proper protection. A good way to remember it is you go from the body out. Gown first, then your mask, then goggles or a face shield, and gloves. Gloves are always, always last.
Now, taking it off, or doffing, this is arguably even more important, because this is where you can contaminate yourself. The main principle here is to remove the most contaminated items first. So that means gloves come off first, then the goggles, then the gown, and your mask is the very last thing you take off. This order is non-negotiable. Okay, now for the other zero-tolerance zone, bleeding. You need to be looking for these signs like a hawk. Any new or increasing bleeding, dressings that are soaked through, a dropping blood pressure with a rising heart rate, and even those subtle signs like restlessness or dizziness. And please, remember the core rule from the guide. If you have to choose between a patient in severe pain and a patient with signs of bleeding, circulation wins. Bleeding beats pain every single time. So as we wrap things up here, it's pretty clear, right? The fundamental shift this guide is all about is moving from being a passive memorizer of random facts to becoming an active clinical thinker, with one thing as your North Star: safety. This final quote just says it all perfectly. Don't try to be a hero. Don't look for some dramatic, fancy intervention. Just be the safe, the methodical, the predictable nurse. Because that is who passes the Nclex. And that's really the final question this guy leaves us with. It's not about knowing more. It's about thinking differently. So, are you ready to stop memorizing and start thinking like a safe nurse? Because that right there is the key to winning the Nclex.